This model of the eye will show both the external and internal anatomy. The size of it is roughly, in this model, about the size of a softball, but yet in real life your eye is about the diameter of a quarter. First, the outer layer here in white is a sclera, very tough fibrous tissue, gives strength and support to the eye and shape. To the anterior, the sclera becomes transparent, called the cornea. Some books still call it the transparent sclera. Then looking at the musculature, the skeletal muscles. This is the superior rectus muscle that would pull the eye upward. There in the gray is the tendon for the superior oblique muscle. The muscle itself is not shown but run in the direction of that pointer. The next skeletal muscle here on the external eye would be the medial rectus muscle. It draws the eye medially when contracting or toward the nose. Next would be the lateral rectus muscle, drawing the eye to the side or lateral or away from the midline view. The optic nerve here has been cut. It would go at a 45-degree angle to the bottom left there into the brain, if shown. Now opening up the eye and looking at the internal structures, those that are the obvious parts. In layers here in blue, this is the choroid layer, or vascular. It has mainly the blood supply. And there's the outer white, or the scleroid coat, the white fibrous protein. And the kind of an orangish red there would be the retina. This would be the nervous retina of the eye, containing the rods and cones. Refer to your textbook, by the way, to help review these structures. The eye is mainly fluid contained in cavities. This would be the posterior cavity, starting at the lens going posteriorly, containing a very thick fluid called the vitreous body or vitreous humor. The pointer is in this cavity. The arteries there, circlet to systemic vessels, would be the retinal arteries in red, and the blue there would be the retinal veins, providing blood to and from the rods and cones. Now a close-up look or a macroscopic view of the posterior eye. This would be the optic nerve containing the neurons connected to the rods and cones that exit the eye. There's the sclera again in white. Next would be that blue choroid coat, or the vascular coat. The optic disc there, painted in yellow, this is an area of the retina that has no rods or cones or any nerves. It does not receive any or create any images. That red there is the macula lutea, very microscopic. Next, to look a close-up here of the anterior part of the eye. First there would be the cornea, or the transparent sclera, very thin dome. The sclera again, here in white, and on the other side the white. These little black marks represent vessels called the Canal of Schlemm that will produce fluid into the posterior there of the cornea. This is called the anterior chamber of the anterior cavity. It contains aqueous humor that was produced by that Canal of Schlemm. The space here is the pupil. Changes shape, of course, to control the amount of light entering the eye. And here would be the posterior chamber of the anterior cavity. This is still to the front of the lens. Refer to your textbook for details on this. Here would be the lens that separates the anterior cavity from the posterior cavity. The black here is the ora serrata. This is the skeletal muscle that pulls on the lens to control focusing. The purple lines represent suspensory ligaments that attach the muscle to the lens for shaping the lens and focusing on objects.